Advances in Health, I'm Rebecca Stewart. There has been so much discussion about addiction, specifically heroin addiction. But today we're going to talk about hope and treatment specifically for adolescents. Joining us now is Pat Reamer, president of the Hartford Healthcare Behavioral Health Network. Now we're opening a newer program specifically for adolescents.
Correct. So, adolescents clearly do get into trouble with addictions, and I think when medication-assisted treatment first evolved, that we really weren't thinking of it as much for adolescents because they're newer into their addiction, and initially medication-assisted treatment was thought for people who were further along in their addiction. But what we've seen with opioids is that it's so involved and so addicting that actually medication-assisted treatment is appropriate for adolescents. So Rushford really has gone on that journey, and we've decided to offer medication-assisted treatment to adolescents that appear to need it.
Tell us a little about the response from parents who are so concerned about their kids and from the adolescents themselves.
I think parents are very relieved that they have another option open for their child. It's a very scary addiction, obviously, and this is just another tool. We need every tool that we can in the toolbox when we're treating addictions, and we know medication-assisted treatment is an evidence-based practice. It has an 87% better chance of a better outcome for an individual who is struggling with any addiction. And so having that as something that we can offer to adolescents, we see as a very positive thing. They may not need to be on it as long as somebody that is older, but it gives them a little bit of a jump start, if you will, to get into recovery and to give them the hope that they need.
And it reminds them that there is hope even after heroin. For more information, log on to WTNH.com/advancesinhealth.